Welcome back, everyone. For the month of March, our station is partnered with the National Alliance on Mental Illness, and although March is winding down, it's important to keep the lines of communication open with your teens and your preteens. Our next guest is here to guide us through that conversation and also pinpoint the signs that your teen might be struggling. Please welcome back lovely pediatric psychologist, Dr. Ann-Louise Lockhart.
Thank you, Kimberly.
Thank you for being here and for coming and always, giving us such wonderful information and tips. So let's get right to it. So again, this is something we should be talking about all year long, right?
Yes.
And be aware of. But what are some of the most common signs your teen or your tween, your preteen, might be struggling with some type of mental, struggle or mental illness?
Yes, there are so many different signs and lots of things that parents should watch out for, but we really want to make sure that, like we've talked about before, is having a collaborative relationship with them so that they will come to us and we can tell when things are not going like they should be going with them.
You're their safe place.
Yes, exactly.
So you have 4 different signs that you wanted to elaborate on, beginning with loss of interest in things they used to enjoy.
Yes, this is a really important one. This is a really key thing when we are looking at depression, especially. And when a kid or a teen starts to lose interest in things they used to enjoy, it really comes out. And it's really something that we need to be aware of because that's a sign that they're starting to become a different person in a sense, and you're starting to lose them. And it could be a huge sign of mental health issues.
Could that be, sports they used to play, hanging out with friends? What types of things?
It could be anything. It could be, maybe it's an instrument they used to love to do. They used to like to travel, having dinners with their family or hanging out with friends, and they just don't find the enjoyment. Even video games. They might still be playing video games, but it's just they're going through the motions and they're not enjoying it.
And as a mom or a dad, you can feel it. You can sense it when something's off.
Yes.
Second, you say significant and sudden shifts in their personality or their mood.
Yes, so teenagers are going to start to change. They're going to find their own identity, right? But the thing is, if you see that their personality is really changing and you're just not seeing the same kind of kid, they're dressing differently, they're acting differently, and they just seem like you're slowly losing them, that's a big thing that parents really need to be aware of.
And scary.
It is
when
scary.
They start to change right before your eyes.
Right, because you want to accept that they are finding their identity, but at the same time, if it's a sudden and significant shift, there's something else going on.
And let's be honest, teenagers, they're going to be moody. Well, that's going to happen regardless, but this is the different situation here.
Yes, absolutely. Absolutely.
Okay. The third sign is noticeable isolation and withdrawal from family and friends.
Right. So this goes along with the first one we talked about with the loss of interest, right? So when they're withdrawing, they're isolating, they're always in their room, they're always by themselves, they're just not wanting to do that kind of socializing. Even if you have a kid who's more on the quiet or introverted side, it's that significant isolation where you feel like they're just disappearing from everything in life. And that's something we really want to look out for.
Okay, and finally, you say chronic negative self-talk.
Yes, so teenage years is a brutal time, starting with junior high and
middle school.
So negative self-talk is going to be kind of part of the process. However, if it's this chronic negative, always berating themselves, saying negative things about themselves, that they're a loser, they're no good, those are things we want to be aware of because that's not what we want to hear, and it could be a really big sign of anxiety or depression or lots of other things going on.
So many things for sure. Okay, so let's say we have a parent watching right now. They have noticed their children is showing one or more of these signs. What can they do today, Dr. Lockhart, and how do they start the conversation?
Yes, so I think it's about noticing first. I always tell parents to use curious language. Hey, I notice that you're not enjoying things like you used to, or I noticed that you've dropped off of playing that sport or that instrument that you loved, or I noticed that. So you're describing the behavior and saying that I notice rather than judgy or being
what's
analytical.
Wrong with you?
Right, like what's wrong with you? Why don't you do that stuff anymore? So I noticed that, tell me what's going on. So it's really about using curious language, using like description language, and then really inviting them to have that conversation with you.
And then hopefully they'll talk to you.
Hopefully.
But if they don't and you need to get professional help, do you just make an appointment and make them go? I mean, it's kind of hard to drag a 14-year-old, to an appointment they don't want to go to.
Right, exactly. But it's really about being collaborative with them and saying, hey, I'm on your side. Maybe you're not ready to talk to me about it, but I think that it's really important to make sure that you get the help that you need, and I'm here to support you. So let's look at some psychologists or therapists together online and see see which one fits best.
Oh, there you go. Let them help
Yes,
make that
do
decision.
it together, yeah.
Pick the right person for them. Dr. Lockhart, thank you so very much for being here. You're so wonderful.
Thank
If
you.
you would like more info on everything she just discussed, you can head to our website. We will post it there, watchdaytime.com, and a link to get in touch with Dr. Lockhart.